All right, so we're diving into some really interesting stuff today, it looks like. Dr. Hassan's, I guess, in his approach to treating sore throats.
Yeah.
And, I was looking at these sources you sent over, and
Yeah.
it's really interesting. It's like Arabic medical advice. You've got some
Yeah.
social media stuff buzzing about Dr. Hassan's method, and even some
Uh-huh.
people, are skeptical about alternative sore throat remedies.
Mhm.
I thought the mix of traditional and kind of modern stuff was really interesting. What do you think?
It's definitely kind of a, ancient wisdom meets the digital age, I guess.
Yeah.
It's creating some interesting conversations and debates. And
Yeah.
I think, our goal today is to kind of help you navigate all this information,
Yeah.
understand what this method is all about, and see how it compares to what we know from, conventional medical advice.
Exactly. And I think before we even dive into the method itself, I'm a little curious about Dr. Hassan himself. The sources didn't really reveal much about him. I mean, was there anything that we could find? It's almost like he's this,
Right.
mysterious figure with the secret remedy or something.
Yeah, the biographical details are really scarce. We're really focusing more on the method itself.
Okay.
And it's interesting because it's got, it's growing in popularity, especially on platforms like YouTube.
Really?
Yeah, so it seems like people are really intrigued by it, even without knowing a lot about the person behind it. And I think that speaks volumes about the kind of allure of alternative remedies, in today's world.
I think you've hit on something there. I mean, in a world of pharmaceuticals and, these really complex medical procedures, I can totally see why this seemingly simple and, natural approach would resonate with a lot of people.
Yeah.
I mean, it taps into that, age-old desire for natural healing
Yeah.
and a sense of control, I think, over one's health.
Yeah, definitely.
So, okay, enough about Dr. Hassan's mystique.
Yeah,
Let's
let's get into it.
Yeah, let's get to the 5-step method. That's really what we're here for.
Yeah, so from what I've gathered, cleansing and honey are, the cornerstones of this approach.
Okay.
It's almost ritualistic.
Okay, now I'm really curious.
Yeah.
So tell me more about these 5 steps.
All right, so imagine this. It all starts with this really meticulous cleansing routine.
Okay.
You begin by cleansing your mouth really thoroughly.
Mm-hmm.
Teeth, gums, roof of your throat,
Wow.
tongue. I mean,
Oh,
nothing
that's pretty detailed.
nothing escapes this cleansing wave.
Okay, so I'm guessing nose is next on the list?
So each nostril is cleansed separately,
Okay.
and then the areas surrounding the nose and mouth, including lips and skin.
Okay.
And then you move on to the skin of the sinuses, eyes, and nose.
Oh, wow. So it's almost like a spa treatment for your face
You're not far off.
and your upper respiratory system. Wow.
Yeah, and then finally, the 5th step introduces honey. Right?
Oh.
So you gargle and rinse with it, and Dr. Hassan claims that this step provides this crucial protection against bacteria and viruses.
So honey is like the shield after all this. Like,
Yeah, like a protective sheet.
intense cleansing.
Yeah, exactly.
Wow, and the sources really emphasize repetition. It's interesting, like, it says you can repeat these steps as often as you, like, regardless of your age, illness, gender. It's like this universal remedy that anyone can benefit from. What do you think about that?
Well, I think that's where things start to get interesting from a scientific perspective,
Yeah.
This idea of a universal remedy
Yeah.
that can benefit anyone regardless of, any factors. Is a pretty bold claim, and I think it requires some careful examination. We need to delve into the purported benefits and weigh those against what we actually know.
You're right.
From, conventional medicine.
We can't just take these claims at face value.
Yeah.
So let's talk about these benefits. I mean, I was actually kind of astounded by the sheer range of conditions that it supposedly addresses. I mean,
Yeah, it's a lot.
it's a lot, right? It's everything from the common cold and sore throats to, more serious things like the flu, COVID-19 and its variants, headaches, even migraines and sinus headaches. I mean, it's a lot.
It's a lot, yeah, and that's just the tip of the iceberg. The list goes on to include allergies,
Really?
mouth and gum diseases, tonsillitis, bad breath,
Wow.
mouth ulcers. It even claims to address stomach bacteria,
Oh, wow.
herpes, eye diseases, asthma, coughs, sneezing, you name it.
I'm speechless. I mean, it
Yeah, it's like a medical textbook.
almost feels like we've stepped into the world of, miracle cures.
Yeah.
Is it even possible for one method to address so many different conditions?
Well, that's where, I think a healthy dose of skepticism is warranted.
Yeah.
While, traditional remedies often have valuable insights,
Yeah.
I think the sheer breadth
Yeah.
of conditions that this method claims to treat does raise some red flags.
Okay.
Before we get swept up in the excitement,
Yeah.
we need to step back and really ask ourselves, okay, what evidence supports these claims, right? What are the underlying mechanisms that are at play here, and how does this compare to what we know from conventional medicine?
Those are some really good questions. I think, before we get ahead of ourselves, maybe we should just focus on one key element, and I think that's the honey.
Yeah.
The sources really emphasize its protective power against bacteria and viruses. I mean, is there any scientific truth to that?
Well, honey has been a staple in traditional medicine for centuries.
Right.
And for good reason. I mean, it's not just a sweetener. It genuinely does have antibacterial properties.
Right.
Research has actually shown that honey can inhibit the growth of certain bacteria, including Staphylococcus aureus, which is commonly implicated in, skin infections and other ailments.
Oh, wow. That's fascinating. So there is some scientific basis for the antibacterial properties.
Yeah, there is.
I mean, but I imagine it's not a cure-all.
Right. It's not a cure-all.
For every bacteria or virus out there.
Exactly. Exactly. And while honey does show some promise, it's really crucial to understand the limitations. Its effectiveness against different bacteria can vary.
Okay.
And it's definitely not a substitute for, appropriate medical treatment.
Yeah.
Especially for serious infections. We need to be careful not to overstate its capabilities.
You're right. You're right. I think that's a really good point because it highlights the danger of kind of oversimplifying these complex medical issues.
Absolutely.
So, okay, we've established that honey has at least some antibacterial properties.
Yeah.
But how does this method as a whole stack up against what conventional medicine would recommend for a sore throat?
That's where the conversation gets even more interesting. Conventional medicine actually takes a different approach. It really focuses on identifying the root cause of your sore throat.
Okay.
So is it caused by a virus, like the common cold? Or is it caused by a bacterial infection, like strep throat? And this distinction is really crucial because it determines the appropriate treatment.
So that's where the antibiotics come in, right?
Exactly.
But I've heard so much about the dangers of overusing antibiotics. Is that kind of related to what you're talking about?
Absolutely. And that's a crucial concept called antibiotic stewardship.
Okay.
And it's really about using antibiotics responsibly and only when they're truly necessary, because overuse of antibiotics can lead to the development of antibiotic-resistant bacteria, which pose a serious threat to public health.
That makes total sense. So doctors really have to be careful about when they prescribe those, It's not just a quick fix for any sore throat. It's funny because some of these sources we're looking at are actually critical of conventional medicine and its reliance on medication. They say that it kind of neglects a more holistic approach.
Yeah, I think there's a valid point there.
Yeah.
I mean, while medication definitely plays a really important role in treating a lot of illnesses, if you solely focus on medication, without considering things like lifestyle factors, nutrition, stress management.
The whole picture.
The whole picture.
Yeah.
Yeah, then that can actually be detrimental. It's about finding that balance,
I like that balance. Yeah, so it's not about rejecting one approach completely.
Exactly.
But considering all of these different factors and kind of finding what works best for the individual.
Yeah, and that's really where open communication with your healthcare provider is key.
Yeah.
They can help you weigh the risks and benefits of different treatment options and really develop a personalized plan that aligns with, your needs and your health goals.
That's great advice. And it really reminds us that we're not alone in figuring all this out, And before we move on, I just wanted to touch on one specific caution that was mentioned in the sources regarding Dr. Hassan's method.
Yeah.
It advises individuals with diabetes to monitor their blood sugar levels carefully if they're using honey because of the sugar content. What do you think?
Yeah, it's a crucial reminder that even natural remedies can have, potential downsides.
Yeah.
Especially for individuals with certain health conditions.
Right.
It really underscores the importance of personalized care.
Yeah.
And seeking guidance from, healthcare professionals who understand your specific situation.
It's about making, informed decisions and not just assuming that natural always equals safe.
Exactly.
Right. Okay, so I think we've covered a lot of ground in this first part of our deep dive. You know, we've explored Dr. Hassan's method, which is based on cleansing and honey. We've talked about its purported benefits, and we've started to compare it to the conventional medical approaches.
Right.
But I think our journey isn't over yet.
No, it's not.
I think there's so much more to uncover.
There is.
And I think we'll get into that in the next part.
Yeah, I think in the next part, we'll delve a little deeper into the scientific evidence or lack thereof surrounding Dr. Hassan's claims.
All right.
And really explore the potential risks
I can't wait
associated with this unconventional approach.
to get into that. This is really interesting stuff. So listeners, stay tuned.
Stay tuned.
As we continue to kind of unravel the mystery surrounding Dr. Hassan's method.
Yes.
And how to choose, you know, the best approach for your own health.
Absolutely.
Okay, great.
Thanks.
Thanks.
Okay, so welcome back to our deep dive into this whole Dr. Hassan's sore throat treatment.
Yeah, you know, I'm really eager to kind of dig into the evidence, or I guess lack thereof,
Right.
behind these claims. It's one thing to have like a traditional remedy, but it's a whole other thing to see if it actually holds up
Exactly.
under, you know, real scientific scrutiny.
You hit the nail on the head. Anecdotal evidence and traditional wisdom, those are, they're valuable as starting points. But we need to go beyond that and see if there's really a solid scientific foundation for these claims.
Okay, so let's get down to it. What does the research say about this whole method? Have there been any studies done that have specifically evaluated?
That's where things get a little tricky,
Okay.
While there's, a rich history of using honey for medicinal purposes,
Right.
rigorous scientific studies, the ones that specifically evaluate this 5-step method, they're basically non-existent.
So we're kind of in uncharted territory here. No clinical trials, no controlled studies.
No, it's
kind of like we're solving a puzzle, but
it's like we're missing pieces.
We're missing pieces.
Exactly, and it makes it really challenging to draw any definitive conclusions about how effective it really is.
Okay.
But what we can do is we can shed some light.
Okay.
By kind of examining the individual components of this approach,
right,
and see what research exists on those individual pieces.
Okay, that makes sense. So let's start with the honey, the star ingredient, right?
Okay.
I mean, we talked about its antibacterial properties a little bit earlier.
Yeah.
But I'm curious to know more. Like, what specific types of bacteria does it actually target?
Okay, well, honey's antimicrobial action is actually quite fascinating. Research suggests that its efficacy kind of stems from a combination of factors, including its low pH, its high sugar content, and the presence of certain enzymes like glucose oxidase, and these properties basically create an environment that's really hostile to a lot of bacteria.
So it's almost like this multi-pronged attack against the bacteria.
Exactly.
But which bacteria are the most susceptible? I mean, I'm assuming it's not a magic bullet for every strain out there.
Well, you're right. It's not a magic bullet.
Yeah.
But honey has been shown to be effective against a range of bacteria, including Staphylococcus aureus, which is, as we mentioned, a common culprit in skin infections, as well as certain strains of Streptococcus, which can cause those sore throats.
Interesting. So it seems like honey could play a role.
It could,
in managing certain types of sore throats, at least.
Essentially, yeah.
But I'm wondering about the broader claim that honey can protect you against viruses.
Right.
Is there any research to support that?
So when it comes to viruses, the evidence is a little more nuanced. While some laboratory studies have suggested that honey might have some antiviral properties against certain viruses, we really need more research to confirm those findings and really understand how that works. What are the mechanisms involved?
Okay, so it's kind of a mixed bag with the viruses. We need
a bit of a mixed bag.
We need more research. But what about the cleansing routine?
Right.
I mean, that's the other big piece.
Yeah, the meticulous cleansing.
Yeah, does science support that? That this kind of thorough cleansing can help prevent or treat illnesses?
Basic hygiene practices like washing your hands and covering your mouth when you cough or sneeze.
Right.
Those are absolutely crucial for preventing the spread of germs.
Yeah.
But there's really no scientific evidence to suggest that this very specific type of cleansing that Dr. Hassan is promoting, with the focus on meticulously cleaning the mouth and the nose and all the surrounding areas, there's no evidence to suggest that it offers any additional benefits beyond those standard practices.
So it's really about separating fact from fiction.
Right.
And not getting carried away with claims that just don't
and not overstating
have that scientific backing.
Exactly. While keeping those areas clean is, generally a good idea.
Right.
There's no real scientific basis to believe that this very rigorous cleansing routine can, cure or prevent all those ailments.
It seems like we're kind of navigating this gray area, right?
Yeah, we are.
With this method. I mean, certain elements like the honey have some scientific backing.
Right.
But the overall method and all those claims that he's making.
Yeah, the broader claims
don't really have that rigorous support.
They don't, and that's why it's so important to think critically when you're evaluating any, medical information, especially when it comes to alternative treatment. You really have to ask the tough questions, like, where's the evidence?
Yeah.
What are the potential risks?
Yeah.
How does this compare to what we know from conventional medicine?
Those are great questions. It's so easy to get swept up in those anecdotal stories and the testimonials.
Yes, it is.
But we have to ground our decisions.
Right, in sound scientific evidence.
In some actual evidence.
Exactly.
Yeah, okay, so the lack of scientific evidence doesn't automatically, I guess, discredit it.
No, not necessarily.
But it does mean we need to be a little more cautious.
It underscores the need for caution. Right. Because, just because something's not scientifically proven doesn't mean it can't be helpful.
Yeah.
But it also means that we shouldn't just assume that it is helpful.
Right. So it's about being really nuanced.
Exactly.
In our thinking about this.
Yeah, it's about recognizing that traditional wisdom often have valuable insights, but we have to approach those insights with a discerning eye and a real commitment to scientific rigor.
I like that. I like how you framed that. It's not about, completely dismissing one or the other, but just seeking a deeper understanding.
A deeper understanding.
Yeah, and making informed decisions based on the best evidence we have.
Absolutely.
So speaking of risks, we've talked about, the benefits of honey.
Yeah.
But I want to talk about the other side of the coin.
Yeah.
Are there risks involved with using honey, especially in this way that he's talking about?
Right. Well, while honey is generally safe for most people, there's some important things to keep in mind.
Yeah.
As we mentioned earlier, people with diabetes need to be really careful about monitoring their blood sugar if they're using honey because of that high sugar content.
It's a good reminder that even natural remedies can have those, unintended consequences.
Absolutely.
Especially for people who have pre-existing conditions.
Exactly. So it's always a good idea to talk to your doctor before you start incorporating honey into your diet or using it for medicinal purposes.
Okay, so it's about that personalized care.
It is.
And recognizing that what might work for one person might not work for somebody else.
Not necessarily, yeah.
Yeah. Are there any other risks with honey that we should be thinking about?
Yeah, so honey can actually pose a serious risk to infants that are under a year old. And this is because of the potential presence of Clostridium botulinum spores.
Oh, wow.
And these spores can actually produce botulinum toxin in the infant's gut, which can lead to a very serious and life-threatening condition called infant botulism.
That's really scary. So even with something like honey, there can be these hidden dangers.
There can.
Wow, that's wild. Okay, so it seems like even with a natural remedy like honey, there are some risks to consider.
There are always risks.
It's not about being, afraid or anything like that, but just about being informed.
Yeah, it's about being informed.
And making responsible choices.
Yeah. Exactly.
I think you've raised some really great points about how complex it is to, evaluate this information and make good decisions about our health. It's really important to think critically.
Absolutely.
But for someone who maybe is new to this idea, what are some practical tips that they can use when they're evaluating health information, whether it's about, Dr. Hassan or any other treatment really?
Okay, that's a great question. Here are a few things to keep in mind. First, you always want to consider the source of information.
Yeah.
Is it coming from a reputable medical institution? Is it from a peer-reviewed scientific journal?
Right.
Or is it coming from a website that's, known for peddling dubious health claims?
That's a great starting point.
It is, yeah.
It's like checking the credentials.
Exactly.
Before you trust the advice, right?
Yeah.
What else should we be on the lookout for?
Yeah, so look for evidence-based information. Are the claims being made actually backed up by scientific studies?
Right.
Are there credible sources that are being cited?
Right.
Or is it all based on anecdotes and testimonials?
Right. Those are very different.
Very different, yeah.
Yeah.
And then it's also important to be aware of any potential biases.
Okay.
Is the information being presented in an objective way?
Yeah.
Or is there a clear agenda? Are they trying to sell you something?
Those are great points.
Yeah.
It's about being a smart consumer of this information, right?
And be discerning.
Yeah, and not just taking everything at face value.
Don't take things at face value, exactly.
Yeah, don't be afraid to ask questions.
Yes, ask questions.
Get a second opinion.
Get a second opinion.
And really consult with qualified healthcare professionals. Right?
Absolutely. Yeah, remember you are your own best advocate when it comes to your health.
I like that. Yeah. That's really empowering advice.
It is, yeah.
Okay, I think we've covered a lot of ground in this part of our deep dive. We've explored, the evidence or lack thereof surrounding Dr. Hassan's method and the potential benefits and risks of using honey and the importance of thinking critically about all this information.
Absolutely. It's been a fascinating exploration, hasn't it?
It really has. But I still feel like we've only kind of scratched the surface.
Yeah, I think so too.
Of this topic. I mean, there's so much more to unpack, especially when it comes to this whole idea of integrative medicine.
Yes.
That we talked about.
Yeah, there's so much more to explore there.
Yeah. Okay. So I think in the final part of our deep dive, we'll kind of delve into that. The potential benefits and risks of that whole approach, how to find a good practitioner, and really reflect on the key takeaways from all of this.
Sounds good.
Okay, so stay tuned, listeners.
Stay tuned
as we kind of venture further into this fascinating world of integrative medicine.
It is fascinating,
and how it could potentially transform healthcare.
Absolutely, it's exciting.
All right, great, thanks.
Thanks.
All right, so welcome back to the show. As we wrap up our exploration of Dr. Hassan and his sore throat treatment, I'm kind of drawn to this bigger picture. This idea of integrative medicine that we've been talking about. It's like a bridge between the traditional and the modern, and it's given me a lot to think about.
Yeah, I think it's a concept that's really resonating with more and more people these days. And I think it speaks to that deep desire for a more holistic and personalized approach to healthcare.
It's interesting because throughout this whole deep dive, I've been struck by how many people are turning to these alternatives, like Dr. Hassan's method. Even when the scientific evidence isn't super strong,
right?
It makes me wonder, what is driving this search for something beyond conventional medicine?
I think that's a really great question, and I think there's several factors at play here. Some people they're disillusioned with the side effects of pharmaceuticals, for example, or they're unhappy with the kind of impersonal nature of a lot of modern healthcare.
Right.
And then others are seeking out treatments that really align with their values and their beliefs. Maybe a preference for natural remedies.
It's like they're yearning for more agency, over their own health.
Yeah, definitely.
To be more active in the decisions.
Yeah, active participants rather than just,
rather than passive.
Passive recipient.
Yeah, exactly. And integrative medicine kind of seems to offer that, right?
I think it does. I think it empowers people to really explore a range of options.
Okay.
And make those informed choices that really resonate with them.
So what are some examples of these complementary therapies that people are integrating? I'm thinking back to the honey and that does have at least some evidence behind it.
Yeah.
What other things are people using?
Well, there are quite a few. Acupuncture, for example, has been practiced for for centuries in traditional Chinese medicine.
Right.
And there's actually growing evidence supporting its effectiveness for things like managing chronic pain.
Oh, acupuncture. That's one I've always been curious about. I've heard, anecdotally that it's really helpful for back pain and headaches and things like that.
Yeah, and there's research to support that now, which is really interesting.
So what else is out there?
Well, yoga and meditation
Okay.
are increasingly recognized for their benefits in managing things like stress and anxiety, even depression. Massage therapy can be really helpful for muscle tension, chronic pain, and herbal remedies. When they're used appropriately under the guidance of a qualified practitioner, can also offer a range of therapeutic benefits.
It's amazing to me how these practices that used to be considered alternative are now becoming more mainstream.
Yeah, it's a really interesting shift.
It really is, but I imagine it's really important to find a practitioner who really knows what they're doing, right?
Absolutely, and navigating the world of integrative medicine can be tricky.
Yeah.
It's essential to find a licensed healthcare professional who has that additional training and certification in integrative medicine.
Okay.
So you really want to look for someone who takes the time to understand your needs and your preferences, and who really works collaboratively with you to develop a personalized plan.
It sounds like a real partnership, which is kind of a nice change.
It is, yeah.
From the sometimes transactional nature of conventional healthcare.
Right.
But where would someone even begin to find a qualified practitioner?
Well, there are several resources available. The Academy of Integrative Health and Medicine, for example, they have a directory of practitioners on their website.
Okay.
You can also ask your primary care physician for referrals, or check with local hospitals and health centers to see if they offer integrative medicine services.
That's really helpful advice.
Yeah, I hope so.
And as we kind of wrap up this deep dive, I can't help but think about Dr. Hassan and his approach to sore throats,
Right.
Even though his method might not have that really strong scientific validation, I think his story really speaks to this broader theme that we've been exploring, this search for healing that goes beyond just the conventional approaches.
Absolutely. And it's a search that resonates with so many people. Yeah. And it's really driving this growing interest in integrative medicine.
Yeah.
And while it is so important to be discerning and to prioritize evidence-based care, I think Dr. Hassan's story reminds us to approach traditional wisdom with an open mind. Yeah. And to really acknowledge that healing capacity that's within each of us.
I love that. That's a beautiful way to put it. It's about finding that balance. Right?
It is. It's about finding that balance
between the ancient wisdom and the modern science.
Exactly. And it's about recognizing that healthcare is not one size fits all. Yeah. It's really a journey of exploration and discovery and personalized care.
This has been such a fascinating journey. We've explored Dr. Hassan's his treatment. We've gone into the science of honey, and we've even talked about integrative medicine.
It's been a really interesting conversation.
What are your final thoughts for our listeners as they kind of navigate their own health journeys?
I would encourage everyone to just be curious, to ask questions and to advocate for their own well-being. Remember, you are the expert on your own body.
I like that.
Embrace the power of knowledge. Seek guidance from those qualified healthcare professionals. Yeah. And really trust your intuition as you navigate this complex and ever-evolving landscape of healthcare.
Well, thank you so much for sharing your expertise with us.
Oh, it's been my pleasure.
It's been really enlightening, and I know our listeners have probably learned a lot today.
I hope so.
So to our listeners, until next time, stay curious, stay informed, and stay well.
Sounds great.